Good morning, everyone. Dr. Christine Smith here with some really cool guests for you today. I'm going to go ahead and invite them on while I'm talking here. So, I have invited Dr. Bryce Applebaum, who is a Neuro Optometrist, and basically he's developed a whole bunch of different programs. Invited Jeremy Strawn, who is the owner of Ralston Creek CrossFit, which is one of the gyms is the gym that I associate with for my office. Hi, perfect. Okay, everybody's here. Wonderful.
Good morning.
Good morning.
Morning.
So I was just starting to introduce you guys to everyone, but also what better way to kind of let you guys talk about yourselves a little bit. So Dr. Applebaum, I was introducing you first and I was about to talk about how you have developed your own program called Screen Fit for helping optometry around all of the screen usage and how it's affecting our neurology and all the screen time kids have to do and things like that, as well as a concussion program and a sports vision training program as well. So I'd love if you talk a little bit about those. And then Jeremy, I'll hop over to you in a second as well.
Sounds like a plan. Good morning to everybody. I'm on the East Coast here. I'm outside DC in Maryland, so it's a little later in the day for me than you guys out west. So I'm a Neuro Optometrist, board certified in something called vision therapy that most people haven't heard a whole lot about. Vision therapy is kind of like physical therapy for the brain through the eyes, with the intention of, correcting and rehabbing concussion symptoms and problems, kids with developmental visual dysfunction that's impacting reading and learning, or people with eye turns as an alternative surgery, or athletes to allow vision to be that dominant sensory system. So much we can do with vision, and I try and let everybody know vision should be guiding and leading, and for so many people it's interfering. So that's what I'm all about, changing how people view vision these days.
Yeah, and Dr. Applebaum and I got to meet, and the reason I wanted to have him on is we got to meet at this really cool conference where all these practitioners come together, and we're just talking about new ways to approach healthcare and approach health overall. And he and I got chatting just about athletes in general and like how much vision plays a role in the neurology of athletes. And then I thought, well, who better to bring onto our conversation than someone who does nothing but train athletes all day to their highest optimum levels. So this is Jeremy Strawn, and he owns Ralston Creek CrossFit. And Jeremy, I think you said you've been coaching for like over a decade now, right?
Yeah, just over 10 years. And I'm a CrossFit L3 trainer, hopefully going to be going for the L4, which they just released. And here based in Arvada, Colorado.
Yep, and I watch Jeremy work with the athletes, and I'm fairly picky about the gyms that I'll work with because I am a huge component of form, and that ties back into all the neurology that we're going to be talking about, because it's really easy to injure yourself if you're not working out correctly. And this is why I thought this was a really important topic to address, is because I think a lot of people are well-intentioned in exercising their bodies and getting fit, but if you are doing things without having the right point of focus for your vision, or you're not engaging your muscles in exactly the right way, which is what Jeremy and his coaches are particularly good at doing at our gym, is really just making sure that people are engaging the right way and doing like the little fine tuning. And then I'll end up working with a lot of the athletes on more of like the physical care front and just seeing what in their body is not necessarily engaging correctly, and then helping them to engage different fascial lines, or really focusing on kind of the subtle engagement and things like that. So let's, Dr. Applebaum, let's just start with what gave you the passion and the idea to develop the programs that you've been developing? And like when we were talking, when we first met, just about the important role of vision in neurology and athletics, I'd love to just hear your take on that.
Absolutely. So let me lead by saying I'm so jealous of this relationship you guys have. I'm a CrossFit athlete. My box is fantastic, but we don't have this with anybody even close to the level that you guys are at. So your clients, your audience are real lucky to have you both getting your brains merging together. It all started for me as a child. I had very substantial vision problems that impacted my confidence on the soccer field and in the classroom, and just honestly navigating through space and life. I had an alternating eye turn. I had reduced depth perception. I had these developmental delays where I didn't have the skills to be able to meet the demands of life. And fortunately was born to a father who was a developmental optometrist and a mother who was an occupational therapist. And I attribute so much of my success in life, athletically, academically, even interpersonally, to what was trained for me and the practice that was created for me, where I literally took these weaknesses and turned them into strengths and got to a point where, I could react more quickly on the field than everyone around me because I was really allowing my vision, not my eyesight, to take over. And I think that's a big distinction that most people don't really get. There's so much more to vision than just 20/20 eyesight. And so many doctors are just set on the pursuit of seeing the tiny letters, but in a CrossFit gym and in life and with driving and in sports, seeing is important, but really being able to anticipate where something will be and where you will be, and preparing your body to react is really the name of the game. And so many, I work with a ton of high-level athletes and also really low-level athletes and pro and amateur, and the people who recognize the value and importance of vision really get an unfair advantage over everybody else, because it's almost like a cheat code. I look at it as low-hanging fruit, but in baseball, be able to know where the ball is going to be and to adjust your body to different speed pitches, and in CrossFit to be able to plan how many steps you have to take, or when you're upside down and inverted to know, the least amount of work to get to where you need to be the fastest. I mean, that's so important. So vision is trainable. The brain is trainable. Vision problems are brain problems. And, that manifests in so many areas of life.
So I love that. And Jeremy and I are actually just talking about something earlier that I think could be like a really good example to start with. So, and Jeremy, I'll kind of let you speak to it a little bit. So he was saying that in some of the clients that he has, as we age, our vision changes. And then, just for people who are a little bit less familiar, what Dr. Applebaum is talking about is like we have our sight, right, which is like the 20/20, like how clear are things. But vision, I think, and correct me if I'm wrong, but is more about how your brain is actually interpreting depth perception and how fast a ball is coming at you, or how far away that step is. And that's what Jeremy and I were talking about earlier, and I'll let him talk about what he sees in class. But it's like, as we age, sometimes that jumping up onto a box is a little bit less clear than it might have been earlier in our life. So why don't you give us your thoughts on what you see in class?
Yeah, so in class, especially with boxes, but same with doing wall ball shots or different throwing technique work, we see that a lot where people are very hesitant to jump up onto the box or to do a wall ball or be able to actually hit the target properly. But of course, with repetition and practice, we're able to get them more familiarized with the process and the movements, and then they develop even beyond that, I would say. So we always look at every movement, every exercise that we do is always a progression to the next thing. And so a box jump is a progression to a box jump over, is a progression to many different other things that'll be profitable athletically for the person, right? And this goes into, we were talking about vitality and our ability to do things throughout life, and jumping on top of a box is just another way to take a step, right? And be able to recognize how tall the step is or how deep it is, to prevent falls. Primarily we were talking about my daughter who just turned 1 and how now she's starting to walk, and Dr. Christine worked with her on Monday, and now she's literally running around the house, which is the wildest thing, because she just started walking. Christine worked on her, did some crazy, awesome stuff, and now she's running around, which is just, and you can see it in her too. She wants to start to jump, and she's reading those things now. She was starting to kind of measure up a couple plates to see if she could step up onto those plates yesterday, which it's really neat to see. So we see it a lot. The main thing would be preventing injury for us, right? In that vitality for a lot of people that are getting older, but for someone my age, it's being able to perform at our highest. And a lot of that goes into vision, like you said, not just eyesight, vision.
So if you think about what vision is for, like it's a sensory system intended to guide movement. And for your daughter, like when she's born, when every child is born, the visual system is not in place. And then through our life experiences, we develop the ability to use our eyes together. And we develop the ability to track and focus and all the eye coordination that's needed for life. You know, Christine, you bring up an interesting point saying vision deteriorates with age. It really shouldn't. And that's kind of mind-blowing for so many people. And I think, you know, what you're seeing with so many of your clients in the gym is not necessarily vision deteriorating, but not trusting what they're seeing and not
The
being able
neurology
to
changing.
Yep.
100%, and knowing, you know, whether they're aware of the depth that exists between them and the top of the box or not, even just kind of the visualization, the ability to kind of visualize how their body's going to get to that point and can I make it and how much effort do I have to put in and how low do I have to go. The only thing visually that should change with life is that internal muscles responsible for clarity get a little more rigid and less flexible. And so usually in our mid 40s, we start to have to do this and up close becomes an issue, but CrossFit's not taking place here. So, I mean, it's more understanding, you know, how to motor plan and how to take visual information and know how to direct the action that's needed.
So will you talk a little bit more about that and like how you address some of that in your programs? Because I think that's such a cool concept. And that's, you know, and this is what I talk to people about a lot is like, your neurology, like, yes, there's aging, but we've just been trained to think that it's like this normal thing that we deteriorate. But I always, you know, I kind of jokingly say with people, hey, anything you do every day, you can do every day. And, you know, you see those people in their 80s who are still running, and it's because they run every day. And so it's like these things that we do and the types of training that Dr. Applebaum offers is for maintaining these pathways so that they don't deteriorate. And like Jeremy's one of the fittest people I know, and that's because he does this every day. And one of the, like, I work on him often, right? And so I know his body well. And it was interesting because he did this challenge for himself called 75 Hard, which is like 2 workouts every single day. One has to be outside, and you're reading every single day, and you're doing a really specific diet every single day. You'd think doing that much more work that his body would need more work, when actually he needed less work when he was doing that consistency all the time, which was really cool to see. So yeah, I'd love, Dr. Applebaum, if you talk a little bit about your courses and how we kind of maintain maintenance of the neurology.
Yeah. So the old saying, if you don't use it, you lose it. I mean, that really does apply to so many areas of life. You know, the majority of vision problems are preventable and treatable, but most people don't know that. And so to really simplify it, we've got inside muscles of our eyes, we've got outside muscles of our eyes. They control the pointing and focusing to be able to know how to make something clear, how to make it single and keep it that way. Technology being introduced at earlier and earlier ages for kids, and kids being asked to read in kindergarten when very often they're not visually ready for these demands. That's when we see these avoidable vision problems happen. And so, you know, ScreenFit, for instance, builds the visual foundation to support staring at a screen all day long and making the really careful eye jumps, the tracking eye movements to be able to read on a screen and to be able to focus at the right plane, where you're focusing at the plane of the screen, not in front or behind it, or, you know, converging your eyes to see a single clear image. You know, I think these are just like you build foundations in CrossFit, and I'm sure everyone starts with the foundations program. You want to make sure, can they squat with good form before you're putting this heavy load on? It's crazy, you know, even when you just look at kids' ability to follow a moving object across their midline, or to be able to catch a ball, and that's so much goes into that neurologically, and yet those kids are then being asked to stare at a screen all day long. Or as adults, you know, we're working, talking with people, and now we're doing this virtual life where we're not meant to be staring at screens in general, much less for 8, 10, 12 hours a day. And a good analogy I give is, you know, if you were to squeeze your fist really hard, after a few seconds it starts to hurt. But if you were to do this, you could do it for a lot longer. You know, maintaining flexibility and taking vision breaks and being able to explore the world is so important to prolonging, you know, what we have. And all the programs I have start with from a foundational level, but even the sports vision training gets to a really high level with visual cognition and the brain's ability to process information and to be able to see things from other perspectives, and to be able for athletes to learn a playbook more efficiently, or to scan the field and take in more information with less eye movements. And what's cool is a lot of athletes, even in the CrossFit space, you got to visualize something to know you can do it, or you've got to be able to have learned from experiences to perfect it. So much of that is accessible if we're asking our brain to think in that perspective, or if we're arranging the conditions to raise to our awareness what we're doing, so we can learn how to self-correct and self-monitor. So the screenfit.com is awesome for everybody, but there's a few others that are much more targeted to specific needs, and for concussion and for other areas where vision is always impacted, not eyesight. So vision, the eye movements, the processing, the converging, the focusing, all the stuff that we need to be able to stare at anything in life for extended periods of time, and then to be dynamic with how we're reacting.
Absolutely. And I think the reaction time is like a huge part of things, right? Because our brain is always correcting all these things underneath the surface really, really quickly. And when we talk about a millisecond, it's about the time that it takes my hand to go across the screen. And like in that little millisecond, your brain just did like 1,000 calculations to figure out exactly where your foot is supposed to land so that you don't end up face first down on that box. So, and like these are the little things that we end up practicing and training. So I love giving people like realistic, real world exercises to kind of like take their brain through the process of everything that we're talking about, right? And normally, like logically, the way that these things fire in your body, I would start with Dr. Applebaum first, and then I would go to myself to talk about really subtle movement, and then I go to Jeremy to talk about like really big movements and refinement. But because everyone's brain is trained to think about big things first, I'm gonna have Jeremy go first, and we're gonna like let's just pick a squat, right? Something simple that lots of people know how to do. Let's just pick a squat, and we're going to talk about all the things that Jeremy looks at when he watches somebody squat to make sure that they're doing it correctly. And then I'm going to comment on anything that I might think about when it comes to like really subtle movements, like internal engagement of different fascial systems. And then I'd love for Dr. Applebaum to comment on all of the neurology going on with everything that we're talking about and why this is so important. So, Jeremy, what do you look for when you watch somebody squat to make sure that they're doing it perfectly right?
Perfectly right.
Yes.
I don't know if there is perfectly right.
Ideally correct.
So as coaches, we always start with midline stabilization. We take the big things first. So we're always looking at the spine, being able to stabilize midline through the entire movement. And then as far as the locomotion of it, or how we initiate the movement, it would be setting the hips back, being able to keep knees pressed out, staying flat on their feet, not having ankles cave in or roll. Chest being able to stay up is one thing, but that's kind of that midline stabilization piece that we look at. And then just the neutral cervical spine as well through that. Those are the big pieces. Now, there's going to be so many small, subtle things that will help kind of key you in, even to where we watch their feet a lot to see what's going on in the pressure points of their feet. And, if you can actually see their glutes, are they activating at the bottom of the squat? And you can tell just by the way that they're shaped at the bottom. So there are a lot of little nuances that takes a little time to be able to read, but those would be the big things that I'm going to be looking at.
Absolutely. So I couldn't agree more, right? Like having everything over center line is so important, making sure that you're actually using your glutes to lift instead of some of your other muscles. And this is what I'll see in people. And so the things that I'll see come into my office, right, is back pain, knee pain, shoulder pain. Like those are the big ones that often come in a lot. And sometimes just by doing some little tiny tweaks, I can help someone not do what I call like front loading so much. And this is what I'll ask, Jeremy or other coaches to look out for. If I see this happening for a client, I'll be like, hey, I want you to ask the coaches to watch your form on this particular movement so that they can catch it, so that we can fix it and we can retrain the neurology. But I had someone come in with, she's had knee pain forever. She's tried all the things. And I was like, okay, I just want you to focus, just stand there. And I want you to bring your attention to the inside of your ankles. She's like, okay, yeah, I brought my attention there. It's like, now I want you to perform a pelvic floor contraction, same muscles that you contract to stop yourself from going to the bathroom. And this is called a Kegel, if you've ever heard of that. While you do this, I want you to feel the inside of your ankle. Do you feel it subtly getting tighter? She's like, yes, I do. It's like, this is your fascial train. Most people completely forget about their pelvic floor. So I have to retrain people all the time about how to actually engage their core, because your pelvic floor and your diaphragm and your abdominal muscles and the muscles of your back wall, that is your abdominal core. It's actually a sphere, and most people forget about that. So just those subtle things like, okay, I want you to do a little bit of a Kegel. Now I want you to reach through the crown of your head so that you're half a centimeter taller while you're looking at this point on the wall. Then I want you to corkscrew your heels towards each other on the floor so that it engages the adductors in the middle part of your leg. And then now as you come down, I want you to hold all of that. And as you go back up, I want you to focus on squeezing your glutes together to come back up. All of a sudden, her knee pain was gone. So it's this specific kind of engagement while we focus on form. And then we retrain all the subtle muscles that you've completely forgotten about. And most of what I work on in athletes is their stabilizer muscles. And your stabilizer muscles are like the teeny tiny ones, like your tensor fascia lata. Most people think of their IT band going down their leg. The TFL is a little triangular muscle like this big up near your hip that is technically the muscle that the IT band is attached to. And if that muscle isn't stabilizing correctly, then you can get weird knee pain and things going all the way down the leg. So focusing on those stabilizers was one of the things I do the most, because they're incredibly dense in neurology, and they send the signals back to your brain correctly so that your brain can send signals out to your muscles correctly. And then when we get all these things working in concert, you actually get a stronger lift because your muscles are able to fire to their full capacity without worrying about getting injured. So now I'm going to go over to Dr. Applebaum, and I'd love to hear your neurology take on all that.
Yeah. So the cues are so important, and you bring up visualization and knowing what to execute before you do it. I mean, most people think squat just, get down as quickly as we can, but when you actually recognize and think about what's involved, I mean, it's obviously so much more complex. I think talking with clients on where to look and where they're fixating is so huge. Very often, if somebody's not, if they're using more anterior chain and not firing their glutes on a squat, ask them where were you looking? And oftentimes, I don't know where I was looking, but even looking higher up can change posture and get you leaning back more, or vice versa. If you're trying to get quads engaged, looking lower down and getting your whole torso to lean forward. But I think the key from a vision standpoint, we've got these two pathways that respond to our world spatially. One that relies on central focal input, and the other responds to peripheral ambient input. And a normal healthy brain, in a situation where those are firing simultaneously, we can see what's in front of us and around us and take it all in to really have fine-tuned depth. But under stress, in general, we become really focal and we lock in. And on a squat, when you're like, oh man, can I lift this? This is a PR. I don't even know. I mean, there's self-doubt, but then visually you become more locked in. And very often that throws your form off, because you're either so fixating on that one point that, your form adjusts. And I think very often being in that kind of flow state that so many athletes talk about, where things are automatic and unconscious and efficient, and you're just seeing, reacting, and moving. When you can get enough repetition with a squat and and you're not actually thinking about where you're looking, you just know, I need to focus on this point on the wall, but take in as much around me as I can. It literally gets the pathways that allow for stabilization to come to the front burner. And you brought up midline. Body midline matters, but visual midline very often isn't coincident with body midline. And then in that case, let's say somebody's perception of what's straight in front of them is actually a little bit dislodged to the side because of a head injury in the past, or a dominant eye, or an imbalance between how each eye is focusing, or even the prescription between each eye. Somebody like that on a squat may have to look a little bit right of midline which then shifts their body to what is actually balanced and equilibrium, but they don't perceive it as that. So I think that's why, having coaches and medical practitioners and badass chiropractors on top of the form, really helps individualize for that person. And, I think knowing how much goes into that, even just from getting the different areas of the brain to link and sync and then respond that way under stress, with enough practice, we can get there, but under stress, everything's different. So you probably see somebody an air squat is very different than with a load.
Sure.
Yep.
It probably shouldn't be, right? If you know what you're doing.
Well, and I just saw like a little question come in. So someone said like, well, what about floaters? And what about like other eye issues? So, for people who wear glasses or who have had a concussion, like what are some of the differences that you'll see, and like what are things that people can focus on to help themselves with that?
Yeah. Well, so floaters are really common, and people always ask about them. There's goo inside of our eye that is like jelly-like, that as we age, that is one thing that changes, and it becomes more liquefied and less gelatinous. And so oftentimes you'll see where something was attached separates, and you see this annoying thing floating around. If you're seeing floaters, definitely see an eye doctor, get it checked out. That's structurally, but functionally, so often floaters are almost like a hypersensitivity to the visual world and all of this static that the brain's not processing. So brain fog is really common. Visual snow is really common after head injuries, or almost like a tunnel vision effect where we lock in and collapse periphery because our brain can't filter the input from both of our eyes at the same time. That happens really often. But I think from a vision standpoint and a symptom standpoint and prescription standpoint, other than when we're developing, our prescription shouldn't really change after our bodies stop changing anatomically. Yet people's prescriptions change forever, not because their eyes are necessarily getting longer or shorter or becoming more like a football than a basketball. There are conditions where that does happen, but in general, we're adapting to the lens we're in because of the visual stress from our environment. And then we're treating the symptom, which is things being fuzzy, and sharpening that then locks the muscles in, and then that becomes a new normal. We then adapt to that. We need something stronger for the same clarity, and we go down this vicious cycle, which is so intimately tied with near work and screen time and visual stress up close. Kind of like if you were to be always wearing a weighted belt, always wearing a belt or even a weighted vest, you can then prime the system to have that be to need that. And then moving forward, you're not engaging your core. And so from a vision standpoint, you're on a screen all day long. That starts to get blurry. We then, the distance blurs a symptom of that near problem. Well, if we address the symptom, your prescription's changing. If we find the root problem and the root cause, which is maybe a rivalry between both eyes' sensory input, or focusing in different planes, or the eye's not able to converge, or spatial mismatch, if we eliminate that root problem, then the symptom of distance blur is no longer an option. So people's prescriptions, there's ways to dramatically change and decrease prescription based off of meeting the demands of life. There's ways to ask your doctor to be 20 happy rather than 20/20 HD clear. Most of us, if we're seeing locked in at any distance, that's too clear for a lot of people. Yet that's kind of the obsessive pursuit of many doctors, is we got to get you to see the tiniest letters far away or else I'm a failure. What about seeing something small enough that it's comfortable, that allows you to see a street sign but gives you some wiggle room for up close so you're not over focusing your eyes? So I think that's something where, the functional side of vision is so often overlooked, and of course I'm biased, easily the most important piece to the puzzle.
Well, and I love it, right? And I love doing these live because I get to see fun questions come in. So I just had somebody else ask like, okay, well, what about the connection to the spine? And I was actually going to bring this up anyway. And then maybe Jeremy, while I'm talking about this, can think of like a cool case that he knows of where, somebody has dealt with an injury, and then watching their body kind of go through the recovery and get back on board with being able to perform in the way that they want. And so when we talk about injury or like the spine, like, you know, chiropractors, the reason that we focus on the spine is because it's kind of like the motherboard of your neurology system to your body. Like, yes, obviously your brain is where all the signals come from, but your spine is how the signals get everywhere else. And it is the thing that is the most vulnerable to basically all of your outside experiences, because it is holding you up and moving you and bending and twisting and adapting to life and allowing you to do everything every single day. And so this is why we spend a lot of our time and attention there, because when we address certain segments of the spine, it'll affect the neurology going out to your limbs. Like, you know, I have a lot of people come in with shoulder stuff, and the first thing I look at is their neck to make sure that the signal going into their arms and to the muscles is actually correct. And so when we're talking about things like injury, so really common one that I'll see in CrossFit, right? Shoulder injury, probably the one that I treat the most, usually right over the scapula. A lot of people feel it in here and they think it's actually coming from here, when actually it's coming from here and back here, and that's referral pain. And we used to joke in school, we said the doctor who chases pain is lost. And so it's like, it's usually not always exactly where the pain is coming from. You have to kind of track down in a little bit more detail, like what's actually going on. And so there are funny things that happen in injury, like when we get injured, we go through an inflammatory process. This is how our body heals, right? And there's usually 4 stages, but we can get stuck in a certain stage and we can just kind of like cycle on that stage. And that's how we get stuck in chronic inflammation. And that's usually when people come into my office, they're like, oh, I've had this thing, it's been here for months, like, I don't know what to do about it. And, you know, most of the time your body will clear it up, but sometimes you need a little bit of extra help. But one of the funny things that happens during this inflammatory stage, especially when you get stuck in it, is your body, in an effort to get all the right cells to the area, has made its tissues a bit more permeable. And basically, this means that your gut has also become more permeable. And that can mean that you are a little bit more sensitive to foods and toxins and environmental stressors than you might be. And let's say that, you know, you're dealing with a little bit of stress on top of it, because who wouldn't be stressed out when you're injured? And I think the emotional stress component of an injury is one of the things that gets skipped in healthcare the most. So now we're stuck in this like little inflammatory phase. Oh, not that big a deal. But then the holidays come around and we're eating all the dairy and we're drinking all the coffee and we're eating all the gluten and the eggs and the things, and we're cheating and having alcohol. And, you know, it's fine. Like, you got to live life and do all those things. But when that's happening and your body is already a little injured and you're kind of stressed out, now your inflammation levels are going up. And then it's actually starting to also affect your brain, because when your gut barrier gets leaky, your brain barrier gets a little bit leaky. And then that ties back into things like vision, right? Because all of your visual stuff actually comes from your brain. And so this is why like people can get injured and then you maybe like your gut starts to be less happy. Or I just saw a question about headaches and things like that. And headaches can totally be from a structural thing, especially when they're like coming up and kind of clamping around like this, but they can also be from inflammation. And so these levels of inflammation, these are the things that really start to cause our body to maybe like deteriorate over time. Is it's these little bits of inflammation that we don't really know are there, and then we kind of perpetuate them, and we never, especially in today's society, we don't rest. We don't give ourselves time to get out of that inflammatory state, or we don't like acknowledge in our brain of like, you know, I just busted my shoulder in October. Maybe I shouldn't eat all of the sugar over the next 3 months. I should just like take that into consideration for my body. And we just forget to do that. So it's like, this is a cycle that people get stuck in. And then when you're inflamed, your ligaments also become more flexible and looser. And your ligaments have a ton of neurology in them. Your ligaments are like the duct tape that holds your skeleton together, but they have little nerves in them that help your body know where it's at in space. And so then your balance gets a little bit off. And then maybe you take a little fall. So it's like, these are how these things can cascade. And for myself, I know like my body went through a hard time, and I've been having to ease my way back into CrossFit. It's not something I could just jump back into. I've had to honor my body and honor my ligaments and work my muscles slowly so that they could get strong enough and my ligaments could get stronger with them, so that I can do that in a safer way. So yeah, Jeremy, I'd love if you have, it looks like you have one that came to mind, so I'd love to hear your thoughts.
Well, I'd say first, there's nothing wrong with eggs and dairy, okay? Because I
Well,
like
yes,
both of
it
those things.
depends. Let me rephrase. It depends on if you are sensitive to them. So it
Sure,
depends on the state of your
sure.
body at
I
the time.
think, you know, what you're speaking to is chronic inflammation. And of course, inflammation, I think we, you know, in society now, we look at inflammation as any inflammation is terrible, and it's not the case. We want inflammation. You know, as soon as I get done working out today, I'm going to honor my inflammation and actually maybe even try to increase inflammation by sitting in a sauna so that I get more blood flow and it, you know, helps me heal up a little bit faster. But
But you
as you and
also
I
allow
both know,
yourself recovery time.
sure. And really it's more of, you know, learning on how to train at more often requires that you also learn to recover more efficiently, right? So finding ways to do that. You talk about stress and of course nutrition and all those things too, and making sure that you're honoring those things. I think, you know, when you say nutrition, of course, you know, I love eggs and bacon and all the other things, and some dairy here and there too, especially if it's fermented. But sugar and alcohol and all those things, if you have an injury, you absolutely do not have those things. It'll just prolong that for sure. But then also going back to the neurology standpoint, other from a coach's view, the way that I see that is in injuries, and we have them. It happens. You know, I've been injured. I dealt with back issues for years, and not just the stress, but the depression that comes along with that, the mindset that, and then you get into that negative spiral, which actually just keeps that going. So what I have found is the way that I kind of dug myself out of the hole, and now with our athletes here, when they do get injured, first pinpointing what the injury is, because I think the hardest thing is not knowing what it is. And then once we have that figured out, establishing a plan for them on how we're going to recover, and then also letting them know that it's okay if it hurts a little bit. Right. So always that 4 out of 10 is what I tell athletes. Hey, it's okay if it's a little bit, because we have to keep moving. What we don't want to do is just stop. Because again, what happens is that depression, anxiety, all those things kick in, which is a big reason why most of us work out as a lifestyle anyway. Then from there, we can start working on the neurological pathways. I have an athlete that was in today, and her back is hurting after doing some deadlifts earlier this week. So I had her sitting down doing some nerve flossing. And she said too, like, there was pain there, but it wasn't so much to where it made her jump out of position. So just sitting on the floor and bringing neck down to chin and going through that movement in a bent over position helped to kind of show her body. And that's a big piece, is that you're going to be okay. Right. And I think even using words for this. So when people come in and they say that I'm injured or I'm broken, right? I'm just broken. This is how my knee has always been. I'm broken. And it's like, well, hold on a second. You're not broken. Don't say you're broken, right? Your body is trying to show you something, right? Where there's a deficiency, where there's an imbalance. And now our goal is to take that and use that clue to find how to heal that body up and ultimately make you stronger and keep that vitality alive, right? Through the long haul is what we're looking to do. That was a big piece for me. I had a coach tell me, and I honestly, for years, just thought I had a bad motocross accident when I was a kid and hurt my back really bad. And from that day, I think I was 12, I always thought, oh, I'm broken. I have a bad back. I have a bad back. Well, that's not true. And since I've healed up most recently, I PR'd my deadlift, and I'm almost 40 years old now, and I've lifted more than I've ever lifted in my life. And it was honestly part of the mindset and getting through that process of restructuring how that worked to let myself know that my body is fine. So that was a big piece for me. And I think for a lot of our athletes, and understanding that those things are just clues, and now we can use those to find the issue and correct it. So
Same thing
I
happened for me years ago. I had back pain, I had side pain. I ended up not listening to my body, pushing through, and tore my pec in CrossFit. And it was completely my fault for not listening and pushing beyond where I needed to. But I think, you know, self-regulating, self-monitoring is so huge. But Christine, you bring up headaches, and I got to comment on headaches
Yeah,
if that's
go
all
for
right.
it.
I believe headache should be a diagnosis of exclusion, and so many people don't even look at vision, and that's a big precursor for headaches. Headaches in the frontal area or in the side area always have a visual component, very often a huge visual component.
Mhm.
And as the posture queen, so many of the patients I work with get this neck or back pain from pulling in, staring at screens all day long, and the headaches associated in this triad that occurs from literally pulling the world in unconsciously and in this tense state, which so much can be done from so many angles to help that area and to find the right balance. But I mean, there's glasses that can help for vision, not for eyesight, that relax the focus and act as almost like a performance lens to give the brain a better opportunity for the eyes to work together. There's exercises that can develop a rapport with space this way. So like an old school camera, you don't have to not be able to use your focusing system on manual focus. You can use it on autofocus, and you can take in the world this way by using the systems appropriately. So I think just listening to our bodies is so huge, and addressing the healing component from inflammatory standpoint, nutrition standpoint, wellness standpoint, and then the physical standpoint, to make sure we've got the right foundation in place.
Yep. Well, and I couldn't agree with you guys more. And, and I agree with Jeremy where he's like, yeah, sometimes I like to increase my inflammation. Yes, like that's how we get our bodies more fit. It's called basically like a hormetic stress, a good type of stress. And this is how we build our bodies, and we induce, an anabolic cascade. We first have to induce like a catabolic cascade and then an anabolic. But the anabolic is recovery, which is why it's really important to do exactly what he was talking about and do certain things to allow yourself to recover. But then, just as Dr. Applebaum was mentioning, we have to also do it to our capacity, and we have to listen to it. And a lot of people ask me like, oh, like can I take an Advil, blah blah blah. I'm like, yeah, you can, but for me, I actually prefer not to if I don't need to, because the way that things like that work is they decrease your inflammation, which can actually decrease your healing. So you may be decreasing your pain, but you're also decreasing your healing at the same time. And you're also cutting out a pain signal, which is an important communication from your body of being like, don't do that. So we need these signals like pain. A lot of people are afraid of pain, and we've been trained to think like you're never supposed to feel it, which isn't true. It's your body communicating with you, and you just have to learn how to listen to it. So like Dr. Applebaum was just mentioning, if you have a headache, it's your body communicating that like something's off and it needs to be checked. So anyway, I know you guys are busy, and you were so kind in making time in your schedules to do this with me, but this is exactly why I wanted to bring both of them on. So you guys had like a neurological component, we had a physical component, and then we had, the person who's coaching people on the floor every single day and seeing all of this in action. And like everything that we're talking about, it's about learning your own capacity, and no one person can really tell you what that is. You have to learn it for yourself and integrate knowledge from different places, and hopefully work with some different experts that can all help you find exactly what's right for you. So as we wrap up here, do you guys have any last comments, or if people wanted to like learn more about you and your work, where can they find you? And I'll let Dr. Applebaum go first, and then I'll have Jeremy go.
Absolutely. So I think challenge what your eye doctors tell you, and make sure it makes sense. And there's so much more to vision than healthy eyesight. So I think that if that's the take home, eyesight and vision are different, then I've done my job today. For me, you can find me on Instagram, Dr. Bryce Applebaum. I recently just launched a website entirely dedicated to concussion called concussionclear.com, and that's absolutely amazing from an awareness standpoint, ability to work with my team standpoint, and then practice websites, Applebaum Vision outside DC. But this is so cool. This was so fun as an athlete myself, and somebody who's been doing CrossFit for about a decade now. I'm gonna make sure next time I'm in Colorado that somehow we're all together and working out together, because
That'd be great.
This is the dream team.
Absolutely. Oh, thank you so much. And for those who are looking for his website, it's spelled Applebaum, Applebaum.
Thank you.
Yeah. All right. And Jeremy, yes, please tell us about Ralston Creek CrossFit, my favorite CrossFit gym.
Uh, yeah. Ralston Creek CrossFit, or it's ralstoncreekcf.com, our website. And then same for our Instagram handle. You can find us on there. We're located in Arvada. We have the best coaches in the world, I think.
I really
And make
love
sure you
the
have a coach. I think that's the biggest thing. If you want to be serious about longevity, vitality, find a coach. Doesn't have to be ours. Just find yourself a coach, someone that understands your goals and helps you get there.
Yep. And I know we all do online things as well. I know Jeremy has been working on some cool things that he'll eventually have available online as well. And most of those things you should be able to find through our websites. For myself, my link is just in my Instagram bio. You can always just go to our profiles, go to the bios, and the information will be there. And and if you want to work on your health and the nutrition around these things as you're working on the physical aspect, that's a lot of what I do, and just helping people get that really customized and right. And I'll probably be running some group programs coming up here in the next year if you want some support while you're doing it, because that's part of why I love these communities, is because that's exactly what they are. They're communities, so that you don't have to do these things alone and you feel like you have friends supporting you, and it ends up being a lot more fun. So thank you guys so much for joining my community this morning. And this will be up recorded if anybody wants to go back and listen to it. And hope you have a wonderful rest of your day.
You too. Thank you.
Thanks, guys.
Bye.